lot of us have had corns and calluses. They are unsightly, they don't look great, they don't look pretty in open-toed shoes, and sometimes they just even hurt, which is even worse, and we don't want to have to deal with that. Hi, I'm the Fly Foot Doctor. I'm a foot and ankle surgeon and doctor out here in Houston, Texas. I talk to people about their feet. I have some lifestyle videos and contents. Today we're going to be talking about corns and calluses, what causes them, things that you can do at home, and when it's time to see a professional like me and how we can take care of them permanently. If that's a video that you think will interest you, stick till the end. And at the end of the video, if you watch till the end, I'll share a tip that will be invaluable to you because people pay to hear this tip in clinic when they're in consultation with me. So stick till the end and I'll talk to you about it. Let's go. So what are corns and calluses? Corns and calluses are a thick layer of skin that your body produces in order to protect you. They usually protect the area where they feel like there's friction, there's excess pressure. So the body's like, oh no, we have to protect the underlying skin. And so it'll then make this extra skin, which is a corn or a callus, which will then protect the area. Okay, now people sometimes will interchange these terms, but there are some differences between them. A corn will usually go through all the layers of skin and will have sort of like a seed or sort of like a central core, while a callus is more broad. It usually goes over an area of diffuse pressure, so like the ball of the foot or the hands and things like that. And that's more for a callus. A corn, you would find that, in an area where there's maybe a bony prominence or there's excess rubbing in the area. And again, it has that central core. And that's really the thing that differentiates a corn from a callus. Now, there are several types of corns. We have the hard corn, the soft corn, and the seed corn. Hard corns you would find at the top of your knuckles. You see this a lot with people who probably wear shoes that rub on the top of their foot, or maybe even high-heeled shoes. You would see those there, and it really hurts. They're big, they're unsightly, they're painful as well, especially when they're wearing these shoes that are causing that problem. Now, you have soft corns, which you would usually see between the toes, and a lot of the times they're soft because there is some movement that's causing those corns to not be as hard as the top ones, and so they're not as hard, but they still have the central core. They're big, they're painful, they're unsightly. Then you have the seed corns. Those you may find at the bottom of your feet where it's like it's just this spot, and it could be one, it could be multiple. It just hurts, it's uncomfortable. You've tried best you can, but you oftentimes need to dig a central core out. You go to the nail salon, they dig it out, but 2 weeks later it's back and it's painful. So those are the three major types, and we have a permanent solution in the office to take care of it for you if you are interested. But let's talk more about why corns form and how we can avoid or even treat them at home. Again, we talked about how corns and calluses form because the body's trying to create a defense mechanism against friction or against pressure, and it forms this extra layer of skin to help protect itself. Now, in what situations will you have this extra layer of skin that's causing these problems? If you're wearing a shoe that's either too tight or too loose, yes. If it's too tight, it'll likely form a corn because there's direct pressure, direct friction that's causing this discomfort. If it's too loose, it may cause a callus, but again, it's just that rubbing, and next thing you know, a diffuse area of skin either on the side, on your heel, or on the ball of your foot is tight and causing pain. Also, if you're wearing high-heeled shoes, that could also cause a problem. Now, if you're wearing socks that don't fit properly and they're just causing rubbing, again, that could cause a problem. Sometimes you may have some people who have calluses at the tip of their toes because they have hammer toes. And so when they're walking, instead of walking flat and having the ball of their foot touch the ground, they're having the tips of their toes touch the ground. And so you would see they'll have super thick corns or calluses down there, and sometimes the nail even gets super thick as well because they have these hammer toes. So now they have a callus or even a corn down here, and then they have these hammer toes, and then they have some up here. It's just, total craziness that's going on. Also, if they have shoes where the seams or the stitching is thick on the inside, that could be causing pressure and causing discomfort, and also that could cause a corn or even a callus. Now, if you have corns or calluses, what can you do at home? Well, first off, you want to make sure that your shoes are not too tight, all right? So you want to make sure that they're not causing any excess pressure and they're not too loose where your foot is just swimming all around, because that just does not help anyone, all right? Now, if you're wearing high-heeled shoes, there's not much you can do really. If you continue to wear them, them, well, you will continue to have the corns or the calluses. But we can figure out a way, and I know a way that we can treat it permanently where it doesn't have to bother you. Making sure that your socks are loose and they're not as tight anymore. Making sure that after you shower, you can try to use an emery stone or a pumice stone. I don't particularly like to use anything sharp like a blade or anything like that, just because I just don't feel like it's necessary, and sometimes it could cause more harm than good, especially for the demographic of patients that I see. Making sure that you moisturize your foot as much as possible after you shower will be suddenly great, because it'll help to moisturize those hard areas and help soften it. Also, you can use things like moleskin, which you can get over the counter. I don't recommend the callus removers with medication in it, because again, I've seen it cause more harm than good. So callus cushions, over the counter, moleskin, those I would definitely recommend to, again, help to cushion the area and prevent friction around that area. Now, if you've gotten to this part of the video, thank you so much, because now we're going to talk about that tip that we discussed. Now, this is a tip that I tell you, like I give to my patients when they come in clinic to see me. So here's a tip. After you shower or soaking your foot, make sure that you're not diabetic or have blood flow issues if you're doing it. This is for patients who are healthy and have none of these medical conditions. After you soak it, you can use an emery board or pumice stone and file down that layer of thick tissue, okay? You want to file it down as much as possible. Now, if you have a corn, file it down to the point where you're not having pain. I don't want you to hurt yourself trying to do this. You can also use a callus softener before you file it down. That could sometimes help. After you're done, I want you to apply a moisturizer. Some of the moisturizers that I like that are over the counter: Lubriderm, Eucerin, CeraVe, Cetaphil. Those are really, really good moisturizers. Again, they add moisture to the corn and the callus and help soften them. After you're done and you've rubbed it in completely, you then want to make sure that you go over it with like petroleum jelly or aquaphor or urea, like some kind of oil, because you want to seal and lock in that moisture in that part of the skin. When you're done with that one, if it's at night, you now want to take saran wrap and cover it. Here's what that does. It forces the moisture deep into the corn, deep into that callus while you're sleeping. Now, if you sweat or you're hot in your feet, just put a fan around it and that'll usually help it. And then wear a sock over it. When you wear a sock over it, that'll help to moisturize it and again, help to lock in all of that while you're sleeping. So that is my tip. Let me know down below if you're gonna try it, and let me know what the results are after you try it consistently for about 2 weeks. I'd love to hear more about it. Now, if you've tried all of these and you're still not getting better, that is the time to see a doctor. So the big question is, well, when do I see a doctor? When do I see a specialist like you, me, you, me? If you have corns or calluses in your foot and you've tried everything and it's still not getting better, that is when you see someone like me, and I can take care of it, especially if you have it on the top of your toes, they're unsightly. Now is the time to take care of it when it's getting cold, because by the summertime, you want to wear your cute sandals and you want to take care of it now in the wintertime so that it's nice and healed by the time we get to summer. Also, if you're diabetic, you have neuropathy, meaning you can't feel, or you have blood flow issues, you definitely want to see a doctor so they can take care of those areas, because number one, there could be a wound hiding under it. And number two, you don't want those corns and calluses to then cause a wound, because they're so thick and causing excess pressure. So those are the times that you definitely want to see a doctor. Now, if you have a corn or a callus that's getting red, swollen, irritable, there's drainage, absolutely you want to see a foot doctor like myself. If you want to see me personally, I'm in Houston, Texas, and my information is down in the description box below. You can give us a call or go on our website and book an appointment. Again, we can do this procedure to remove the corns in the office. It's quick, it's easy. If it's with a hammer toe, we can also still take care of it. That is something we can totally do in the office, and it costs you nothing, because usually insurance can pay for it. And if you don't have insurance, again, it's something that is pretty affordable and can be taken care of. So if you want to see me personally, again, the description box is our information below. Thank you for sticking with me till the end. Let me know if there are any of these things that you're going to do. I really, really love to hear it. And especially if you're going to try that tip, and if you do it consistently for 2 weeks, let me know. Take a before and after picture and give me your feedback. Now, sometimes, again, if the corn is super deep, you may need to just cut that whole sucker out, because it's just not going to get better, but this will make it manageable. So let me know down below. If you like this video, would you consider sharing it with your friends and family? I know you know somebody that has a corn or callus, or even yourself and your circle. Please share this video with them. And if you liked it, please give it a thumbs up. I would really, really appreciate it. And now, if you'd like to see more videos, would you consider subscribing to our channel? It'll help the YouTube algorithm. Share this video with people who will really, really appreciate and learn from it. Thank you for sticking with me till the end. It's a Fly for Doctor. Till next time, I'll see you later.